So are there any questions at this point about acupuncture?
Just following up on that sedation point there. The thought must go through all our minds here, you know. You've got a dog on a table that's in there for 20 minutes. How are you maintaining the calmness?
You mean for the acupuncture?
The acupuncture, yeah.
They're pretty good. You'd be surprised. Like I've been doing this since 2006. I can readily think of a couple dogs, just a couple that just were always, you know, we had to kind of, you know, hold it and pet it during the acupuncture. And it had a bad back, so it always benefited greatly from the electroacupuncture, but it didn't really like to be acupuncture because it was a Jack Russell Terrier. You know what I mean? I mean, they don't want you to hold them or do it. They want to do what they want to do, period. So, you know, but most of them do really well. That's what I'm saying. The first time they get an acupuncture treatment, I usually, depending on the size of the dog, if we do it on the floor on a blanket or on the table, I put the, you know, acupuncture needle in there, and then I just put the rest in. And the first time they're kind of like, "What are you doing?" But then after that, subsequent visits, they get it. They kind of relax. It's not bad. Once in a while, especially when you do that gallbladder point behind the ears, they'll shake and throw the needles everywhere. That's a disaster. They have to start over. And once they often do it a couple times initially. But that's a tickly point. It just tickles them to, you know, no end right there. So, but besides shaking occasionally, they're often very, very good.
What about cats? How do they tolerate?
Cats are great.
They are.
Yeah, most times. Now, if it's a cat that you can't hold or is normally not a lap pet to begin with, I mean, to have it sit for needles is going to be, you know, not something that we're going to be able to do. However, if it's just a regular mellow cat, you'd be surprised. I think oftentimes they do better than the dogs. And I like doing cats freaking neat, and I wish I did more cats actually right now, but I definitely have more dogs than cats, but I love doing cats mostly, and with age, dogs and cats, they all develop arthritis, and cats are totally treated and under, you know, we think they don't get it. Yes, they do. They do get arthritis, especially in the hips. You can start to see that sunken appearance in the back legs. Put them on glucosamine. it's there. Yes?
What about treatment against seizures or the side effects of the medications that typically are used to treat seizures?
That's a great question. I do, if an animal is a severe epileptic and needs potassium bromide or phenobarb, then typically acupuncture is not going to help with the seizures. But I've had some cases that do respond, and we do acupuncture points for seizures. Actually, GV20 is one of them. GV20, the other one, the tickly one, is another one also. In Chinese theories, it's too much wind. Wind is associated with the liver, so I would do liver points as well. Speaking of liver, what the side effects to medications, I would hit the liver points, right? I want to strengthen the liver, help support the liver, things like that.
Doctor, is the locations for these points the same on both sides of the animal?
Yes. Yep, it's
So
symmetric.
Okay, so it can be left or right?
That's right, and you don't necessarily, although we always almost do, put our needles in bilaterally and symmetrically. In theory, you don't have to. And if I have an eye problem on a dog, remember the bladder meridian starts, well, anyway, I probably didn't tell you, but it starts right at this point of the eye, ends on the back ankle. In theory, if I want to do the bladder meridian to help treat a corneal ulcer, I could do any point on the bladder meridian to help treat that eye. I don't have to get right by the eye, although often we will put them around the eye for an ulcer and stuff. But in theory, I could use anything on the meridian. Or I could consider using liver meridians, because liver is associated with eyes.
So to follow up on this gentleman's question on
Yeah.
the procedure itself, you don't use sedation at all.
No,
You never
no.
have to do. You never have to do.
No,
it.
if they're
So
that
what-
bad, and I can't, I'm trying to think if there's any, I
So
wouldn't.
what about the needling itself? Do you use, as far as sterility, do you use disposable needles?
Yes.
Do you swab the site that you're?
No, no swabbing.
Because for human acupuncture, you have to
Nobody
sterilize
swabs
the site.
me. The needles are sterile,
Right.
but you're still going through fur and everything.
Going through fur.
Exactly. But we don't in veterinary medicine swab anything before we take blood. We'll put alcohol down to help visualize the vein. It might help clean things, but you're still using a sterile needle. Think about horse industry, they might swab it, but, we're just not doing it that much. And for human acupuncturists, I mean, they use sterile needles as well, but when I go, they don't sterilize me or put an alcohol
So
pad
given
down.
that, in your 8 years of experience,
Yeah.
have you had site inflammations?
One time, and I'm not even sure if it was from me, but one time, yeah. So here's the way to avoid any kind of causing a little localized abscess or inflammation. Soaking wet dogs are out because there's gonna be easier to see bacteria through the skin. So I don't do soaking wet dogs. If it's raining out and it's time for an acupuncture session, then they either have to be dried off well or skip it.
And you mentioned that you don't get, with a person, you get the patient feedback.
Yeah.
Have you found the site? Have you de-cheated that site? And you don't have that ability
Right.
with a dog.
Which is great, because there's no placebo. That's the nice thing about this, because there is no placebo. The dog is either doing better or not.
So when you just chart the dog, do you actually dye mark the skin or anything for?
No, I know by feel. And you better learn by feel, right? Because I have long-haired dogs. You have to find every point, that's why you go through training. It's all by, you have a bony prominence, okay, and you can feel them. You can feel the acupuncture points. They're little depressions.
Excuse me, is Wobbler's disease and vertigo, like vestibular disease, almost similar?
Well, vestibular is like some kind of inflammation in the inner ear.
Okay.
And then the wobbler's instability of the vertebrae. So they are a little bit different. Yeah.
Yeah.
How
But
long is the training process for acupuncture and veterinary medicine?
Well, because in this country, we're veterinarians first, and then the acupuncture courses are usually a week or so, a month, for like 5 months, 5 or 6 months, and then you have an exam where you have to find your points, a written exam, then you do 40 hours with a certified instructor, and then you have a case report. That's how you become certified.
You mentioned kidney failure in cats or kidney disease.
Uh-huh.
Does it prolong their life? Does it just make them more comfortable? What does it do?
I don't have any hardcore studies that I've done or anything to say that it's prolonged their life. I would say yes, it would, because what I'm finding is animals that have renal failure that I put on some herbs and do acupuncture, they get more comfortable, they look better for a longer period of time. I think it enhances, there's no doubt, their quality of life.
see that.
Yeah.
So the acupuncture would benefit a dog that has vestibular, or like how would you?
Yes, it could. Is it idiopathic vestibular disease? Or it has chronic vestibular?
Yeah, all of a sudden it came on, and she's been to the neurosurgeon. and
Okay.
Ruled out a brain tumor.
Okay, the thyroid's been checked up the yin yang, I hope?
There's kidney issues.
Okay.
It just came on real sudden.
Oh,
Or I
okay.
thought it was a seizure, and so she was treated for.
So she's on medication for seizures?
No, she doesn't
Oh.
get seizures. She just has
Oh.
the head,
Head tilt?
and when she shakes her head, it goes like this. But then she's okay. Then she's balanced again. She doesn't have an acute.
It's not the whole time her head tilt?
No.
Okay.
Yeah. But yeah.
Yeah, potentially, absolutely.
Yeah.
I'd have to think about like what is the process going on here.
I had her to the chiropractor, holistic chiropractor.
Uh-huh.
So she thinks that you can actually she can benefit with acupuncture.
Sure,
So that would be the
absolutely.
next step.
I have done vestibular dogs before.
Uh-huh.
There's more to the picture. I'd probably do kidney points as well.
Yes.
Absolutely. And it's so funny with Chinese medicine, I would sit there and think about that case because somewhere in the Chinese theory, that all will be connected. Whereas in conventional medicine, it's separate: kidney, vestibular, separate entities. If I thought about it and got my theories right, that would all be connected with some kind of deficiency with something. That's what's really cool about Chinese theory. I mean, they've been doing it and improving upon it for 3,000 years, and it's amazing. So that's why I always try to keep thinking in like that with each acupuncture case too, because I think it enhances the outcome.